Dr. Lorna Heilig coming to you once again. Today, I wanted to talk a little bit about the pros and cons of virtual healthcare for adults. Now, this is a strong point for me. During the pandemic, I started to think of ways in which I can serve persons who are in need of nutrition services. And so I founded Heilig's Virtual Nutrition Consulting, which is a virtual practice uh, helping people to live healthy lifestyles, but also for persons who have acquired chronic diseases to help them to manage their chronic diseases in a proper manner, providing the appropriate nutrition information and support that they need to help them make behavioral changes with regards to diet and exercise and other lifestyle changes for a healthier uh, body. Now, what I found during my experience with providing virtual services as opposed to on-site face-to-face, it is definitely convenient for those persons who live very busy lifestyles. They are very appreciative of services such as this, or persons who live in remote areas that are particularly underserved. For persons who have mobility challenges and otherwise transportation challenges, this also provides a great service in terms of accessibility that they normally would not have. As coming out of the pandemic and moving forward, it provides a platform where there would be reduced risk of exposures to infectious diseases and conditions. And of course, uh, the savings that come in terms of time and travel and additional cost, where there may be parking and other things of that nature. It's also easy to access me as a specialist and also for other specialists out there, whether they are nutrition specialists or other areas of specialization, who would normally be far to reach. I am accessible to persons anywhere in Florida as well as anywhere that they can access me through having a computer and being able to connect via the platforms that I use. It's also extremely convenient for planning follow-up care, which is imperative, of course, when you are doing it virtually. However, there are downsides of virtual healthcare and virtual nutrition counseling, as I have also experienced. There are sometimes technological barriers with some adults, in particular older adults, um, who are not technologically savvy, but in addition, they just don't feel comfortable. There's not that comfort level as they would feel if they were in a face-to-face, more personalized interaction in a physical location. Um, I have experienced sometimes some connectivity issues where persons, again, who were challenged were not able to maintain the connectivity through an hour's consultation, for instance, and I would have to get back to them almost immediately to have some sort of completion. There is also, it presents a challenge with regards to uh, the possibility of limited physical examinations. Now, since I'm a nutrition practitioner, um, most of the time I rely on clients bringing labs that they've gotten from primary care or information, and my intake uh, charts actually would provide me with all of that social and medical and laboratory data that I would need to work with them. So it's not that much of a challenge for me, but I do know that for some specialties that it may actually provide a greater challenge in terms of the limitations that are set on particular physical exams. And then, of course, we cannot play down the issue that's inherent in the use of digital platforms, which would be security type issues. These are also present when we are in face-to-face physical locations as well. So it's just something that all practitioners are have to be mindful about, and that we are being challenged with in these times. I actually present virtual healthcare for adults and virtual nutrition counseling as a great alternative. As I said earlier, it's convenient, it's time saving, it's cost saving for individuals who are technologically savvy. Practitioners, however, must be sensitive and must be mindful of client and patient constraints and their comfort levels. As I mentioned earlier, follow-up is imperative, particularly in cases where there may be some lack of physical contact that could possibly lead to detection of some health issues. And in such instances where these downsides are very blatant or obvious, practitioners must be mindful that referring out is a great option. I've actually said to clients or potential clients, when I have a chat with them, what is your comfort level? Are you comfortable with this type of an environment for your consultation? If you aren't, I would be happy to refer you out possibly to someone in the area that may have your insurance, or someone else who is actually accepting out-of-pocket payments, depending on the client and their ability to pay. So again, I actually present this as a great alternative, as a very convenient scenario for healthcare, but nutrition counseling for persons who want to go through lifestyle changes, weight management, or management of chronic conditions that they have acquired over time. Again, referring is always an option in those scenarios where clients are not comfortable, because we must put their comfort levels first and foremost as good practitioners. Would you like to contact me or have a chat with me regarding my experiences as a virtual nutrition practitioner? I can be reached on my blog, https://www.letstalkhealthandnutritionwithdrh.com, or on my website, https://www.hyladixvirtualnutritionconsulting.com. I look forward to connecting with you. Bye now.